treatment of early prostate cancer involves the decision of trying to do the safest option with the least invasion. All prostate cancer treatment comes with side effects potentially, but we've identified a certain criteria of patients with small volume disease, not fast growing.
The most important thing to know about prostate cancer and about chemotherapy is that not all prostate cancers are equal and not all chemotherapies are equal either.
So active surveillance means that we are hoping that the prostate cancer never progresses. There is about a 40 to 50% chance that a small prostate cancer will never progress. The whole idea of it is to watch the patient very carefully to pick up those patients who are in the worse arm and who are going to deteriorate, and it's still at an early and treatable phase.
So I did active surveillance for 10 years, so it was regular blood tests, and then every 12 months I see the urologist and he would do the digital rectal examination. And blokes go, ooh, I don't want to do that. Well, that's just one of the ways to find out what the gland is doing. So every year I'd have that, and he'd say, it's nice and soft, your PSA is nice and low, see you in 12 months. But when he felt the gland was firm, it was decided to have a biopsy in January 2011, and it'd come back aggressive. And I was between a rock and a hard place. I had mixed Gleason's of a 6, which is low risk, but I had 7s and it was 4+3, so that was aggressive.
If patients are beyond that and they actually have more aggressive disease, we can then offer them treatment, and the treatment options are usually with surgery or with radiation therapy.
We think that for a reasonable proportion of patients, radiation does cure a proportion of patients with prostate cancer. And I think, again, for that similar group of patients, we think that the cure rates with radiation are very similar to a lot of the other treatments we have for prostate cancer.
Looked at radiotherapy, but decided to go with the surgeon that had robotic in early February 2011.
We have open radical prostatectomy, which involves a cut, and the surgeon uses his hands to feel and remove the prostate. It's very close proximity to the urethra and very close proximity to the nerves which provide erections. So it probably doesn't matter so much which procedure you have, but probably the experience and expertise of the surgeon. We have robotic surgery, which involves small cuts, and instead of we sacrifice the sensation of our hands with beautiful three-dimensional imaging and vision to actually gently remove the prostate gland.
Two main ways we deliver radiation therapy is with external beam radiotherapy, and the other is with brachytherapy. So the most common way we deliver it is with external radiation, and that again is high energy X-ray treatment, but it's treatment that gets given often, at least in the conventional sense, every day, 5 days a week for quite a few weeks. And this treatment is painless. The patients don't actually feel anything at all when they have that treatment. If we contrast that with brachytherapy, so brachytherapy is actually a form of internal radiotherapy. And here, under a general anesthetic, we implant anywhere between 90 to 110 radioactive seeds inside the prostate. Again, it's a slightly different way we deliver radiation, but again, it's still radiation therapy.
Men with higher grade prostate cancers that are more aggressive and we're more worried about, we actually like to use chemotherapy earlier on. So we might even use that at the same time as we start the hormone therapy. But in the past, we've certainly used that when the hormone therapy runs out and when men develop what we call castrate-resistant disease. We've also got more treatments now that we can use for that, and there are other emerging treatments as well, including infusional radiotherapy that we can use to treat metastatic prostate cancers. Hormone therapies also come with side effects that men need to be aware of, and they can actually be quite problematic. And so just treating with hormones isn't necessarily an easier route. People have to still deal with things like hot flushes, fatigue, sexual dysfunction, bone health issues. And the chemotherapy is actually generally well tolerated for the most part.
The most common side effects we see with external radiation is some fatigue, some very mild fatigue. And look, because we give radiation to the prostate, the bladder and the bowel nearby, they get actually temporarily irritated by radiation. So patients will notice some frequency of their bowel, frequency of the urine, at least temporarily during the treatment. Look, we can give medications to help with that. These are temporary. They go away a couple of weeks after they finish.
So as doctors, we always think of medical treatments for things like hot flashes, which we do have. We've got tablets that can reduce the severity and frequency of the hot flashes. But there are other things that men can do, including avoiding things that trigger their hot flashes and trying to exercise as well. That's very important for regulation of side effects, not only for hormone therapies, but also for things like chemotherapy as well.
A lot of work going into trying to reduce some of the side effects from radiation, and one of the things that is being done a lot more in the last few years is something called rectal spacing, which is where, because there's not a lot of space between the bowel and the prostate, if we can actually find that space, sometimes we can actually insert, I guess, a gel or a protective gel, if you like, that actually increases the distance between the prostate and the rectum. And if we can do that, it actually reduces the dose of radiation to the bowel and therefore reduces the risk of side effects to the bowel.
I think people need to understand that if someone does need chemotherapy, it's not necessarily going to be a terrible experience for them.
Yeah, I think one thing we can do in the prostate cancer world is we can get out there how easily this is to treat if you get it at the right time, and how comfortable that treatment can be if it's at the right time. So I think we should be encouraging that, that the treatment of prostate is something not to be afraid of. Go and get tested first of all, and then if something results from that, go and get the treatment, because we have moved on from 20 years ago. We are far more advanced now.